Yeah, so I've mostly been working with Dr. Byrne Lee in surgical oncology. We've done a number of projects together and pretty wide ranging actually. We've been able to look at our peritoneal surface malignancy data, our own sarcoma data, and one of actually my long-term projects actually has been interviewing cancer patients on their perspectives on their cancer care and their outlook on life. It's been a mixed method study that I had an interest in doing. I had no idea how to do it and kind of found tools to help me along the way throughout my PD time to make that happen, which has been a big deal for me personally. I was planning to do this project during my third year, so I was talking to people who maybe had some background in mixed methods research, trying to figure out what I can do to learn more about it. So I took the mixed methods course through Aspire before I started my PD time. I've also been doing a master's in health policy through Stanford as well, and that's actually helped a lot with some of my projects. It's just so broad. You can do anything you want, which is awesome in the sense that you can do anything you want, but also kind of intimidating in that you have to figure out exactly what to do. I had an idea. I was interested in surgical oncology, so I started there and talked to faculty, talked to other people who had done research in surgical oncology. I knew I didn't want to do basic science research, so that took some options away. But when I first met with my mentor, he told me, pick something that I am interested in and that I want to do. And that's kind of how it started with my mixed method study with interviewing patients, particularly young patients. Throughout my third year as a resident, I felt like I was seeing a lot of younger patients with advanced cancers. And a lot of times, it's very uncomfortable for the patient, for you as a resident who's probably around their age, and for the physician who's seeing them as well. Nobody wants to see a sick young patient, and I think that's emotionally difficult for everyone. And I always thought, what is it that the patient is thinking? How are they undergoing this with young kids, or they're just starting work, they're establishing themselves financially, and how is it impacting them? It's going to be completely different for them than someone who's much older. And I decided that's what I wanted to study. I honestly had no idea how I was going to study it, but I felt like interviewing them would be a good first step. So that's kind of where the project developed, and with my mentor, we kind of worked on it together and made it happen. So now I'm done with the interviewing process. I've learned how to, analyze this and how to look at, what people have said, and it's turned into, see what young patients have said is lacking in their care and finding ways to kind of fill that void and give them the support that they need in terms of support groups and, lack of knowledge that specifically helps that age group. I've been very lucky. My research has been funded through the PD grant through Stanford, through the Department of Surgery, and my master's has been funded through the LKS Scholars grant as well. I mentioned I was thinking about surgical oncology going into my PD time, so I was really looking to, do something related to that topic and learn a little bit more, and it's definitely solidified my love for the patient population. I have spent the last 2 years learning more than probably most people about what it is that cancer patients experience, what they worry about, and how treatment and how talking to physicians and surgeons really impacts how they view their life and the hope that they learn and hold on to. And it really makes me just even more want to take care of these patients in the future. One thing I did want to mention is what you go in choosing for PD time and what you come out doing is probably going to be very different, and that's totally okay. I was thinking about this earlier, and what I had envisioned my PD time to look like is really nothing even close to what it's become. But I have to say I am very happy with how it's turned out. I'm really happy with the extra things that I have taken on that really have been interesting to me. And you can't plan for everything. I think you have to be willing to be flexible and willing to change things up a little bit and willing to go off of kind of the expected path, and it will turn out to be okay. And I think most people will say what they're actually doing, now almost 2 years in, is different than what they had expected. And I mean, I can't complain. I've gotten to go to conferences, I've gotten to travel, I've gotten to talk to patients, real patients who are going through real problems, about how it's changed their lives. And after these extremely difficult conversations, they will turn around and thank me. And it's a big deal for them to talk about something so personal. I've been blown away by how much, patients are willing to share about how cancer has affected their lives, and they'll thank me at the end, even though I, have made them cry during an interview, because it's something that's really important to them that not enough people really will, or no one will ask them about, and they often hold that in, for themselves. That was a huge surprise to me, that how willing patients are to talk about it and how appreciative they are actually to have someone to talk to who is, not their provider and not their family member who, they have to face every single day. So surprises happen, for better or for worse. Hopefully more than will be for the better, but it's totally okay. It's probably going to be normal.